Do you know the chameleon of all diseases? A potentially deadly infection that can mimic a myriad of other diseases. It is so difficult to diagnose, I'm not sure I would be able to recognize it even if it was staring right into my face. I am talking about syphilis. Stay with me through this video because I will be giving you information that only specialized doctors have and that you wouldn't be able to find elsewhere on the internet. Because this information could make a difference in your life. Syphilis is back, and it could even affect you. Because since 2018, the number of cases in the US has increased by a stunning 80%. 1495. This is the year of the first outbreak on record in Europe. During the First Italian War, a hitherto unknown and unseen disease broke out among the soldiers of the French army invading Naples. A disease so disgusting and horrifying that German physician Joseph Grünpeck wrote in the early 1500s, so cruel, so distressing, so appalling, that until now nothing more terrible or disgusting has ever been known on this earth. For hundreds of years there was no remedy against it. Only one medicine can cure it. I'm going to tell you what it is in a minute, but here are some facts first. Syphilis is extremely contagious. Usually a sore develops first, typically on the genitals, as it mainly spreads through sexual contact. But these sores can be anywhere, wherever the bacterium by the name of Treponema pallidum enters the body. Typically, these wounds are painless. Other areas frequently involved are the lips and the oral cavity and the anal region. At the bottom of these wounds, it's just teeming with bacteria. If you touch one of these ulcers or chancres, which is another word for them, you will most likely become infected. It will take 9 to 90 days for a chancre to form. By the way, did you know that you can become a member of Eurochannel? I just started memberships. Check out the perks and become a member today to support my work. Your membership helps to maintain the high quality of my content. Many hours of preparation go into each of my videos to bring you the most up-to-date scientific knowledge possible. With time, it'll heal, even if left untreated. But still, you will be contagious. The disease then enters into the secondary stage, which classically consists of a rash on the whole body. This rash includes the palms of the hands and the soles of the feet. Sometimes flat warts form in warm and moist areas, like the vulva or the axilla. These are called condylomata lata. If syphilis is not diagnosed in this stage, the rash will disappear by itself. Still, you would be contagious. This so-called early latent phase will last for 2 years. After 2 years, you will no longer be contagious, but the disease may silently persist in your body. With a latency of 10 to 30 years, it will then come back with severe symptoms, mainly involving the brain and nervous system, but sometimes also the heart and bones. We know from the pre-penicillin era that 30 to 40% of individuals progressed to late syphilis, and of those, 10% developed neurosyphilis, and 10% develop cardiovascular syphilis. The only remedy that is effective is penicillin. So, syphilis sounds pretty straightforward, doesn't it? No, actually it's not. Here is some crucial information you can't easily find on the internet. The single painless ulcer is the classic, but not the only appearance an ulcer can take. In fact, there may be several chancres, and they can be soft and painful to touch. What's worse is that they don't even have to look like an ulcer. Chancres can take on any conceivable morphological form. They can even mimic balanitis. Balanitis, however, is a harmless inflammation of the glands of the penis, which is very common among men. Chancres may even be absent sometimes, which can be a very sneaky feature of the disease. A few weeks or even months after the infection, flu-like symptoms develop. You know, sore throat, headache, fever, joint pain, and so on. Lymph nodes may be swollen. But I mean, hey, this is something that can be seen in a whole lot of infectious diseases. The mentioned skin rash may develop, but sometimes it doesn't. If it does, it often ignores medical textbooks. What I mean is that it can take on any form. So the small pink papules are not exclusive. It can look like anything. It may even look like circular hair loss if it presents on the scalp. Neurological symptoms may be present at this stage too. It's not exclusive to late syphilis. It could affect vision. It could present as meningitis, hearing loss, tinnitus, and so on. And the worst part is, early syphilis may stay asymptomatic altogether. Still, you would be contagious to others through sexual intercourse. I'm a board-certified urologist and sexologist. I think about the possibility of syphilis all the time during my consultations. But even as a specialist, I wouldn't be confident to diagnose it just by examining the patient. So I test them. Usually it involves a blood test. But Treponema pallidum can also be seen under the microscope in dark field microscopy. If you think you might have been exposed to a situation of elevated risk yourself, get tested. Therapy is short-term and will cure you before you suffer from permanent damage. I remember a patient who had ordered a test kit on the internet which turned out positive. He was absolutely free of any symptoms. He didn't have an ulcer. He didn't present with a skin rash. Yet still, he had it. We confirmed it. He was cured by one injection with penicillin. Did you know that pregnant women can infect their unborn children? Congenital syphilis is likewise on the rise. So it is very important to screen pregnant women for this disease, as congenital syphilis has to be avoided at any cost. It is a severe and disabling condition that is also life-threatening to the fetus. The death rate is as high as 30%. If you now wonder what you could do to manage your personal risk, condoms have a high rate of protection. I also advise you to watch this video where I go more into detail on why it is so important to get tested for STIs and give tips for safer sex. Thanks for watching. Bye-bye.